Dr. Layla here. I wanted to talk to you about what kind of pillow you should be sleeping on. I know there's so many different pillows out there, and I wanted to go over what kind of pillow and why it's important to sleep on a cervical pillow, because a cervical pillow has an arch and your neck is supposed to have an arch. The spine in your lower back as well as in your neck has a curve, and that curve needs to be maintained. When you lose that curvature, then your spine degenerates at a greater, faster pace. And we want to avoid degeneration and arthritis as we can, because as we age, we're going to degenerate and atrophy. And if we can avoid degenerative arthritis, or at least slow it down, then it's a great idea. So one way that you can do that is by maintaining the health of your spine. Now, we go to the dentist to get our teeth checked, so we want to make sure that we can see what our neck looks like. And one way to do it is, of course, to get some x-rays of your neck and to be able to see if there's degeneration in your neck, and also to see if there's a curve in your neck. Now, if you're missing that curve, you want to try to get that curve back. And the way to do it is by sleeping on a proper pillow. Now, I was just going to show you the 3 phases of degeneration, and if you can see, this is normal. Now, normal has a curve and it has equal disc spaces. When you see here, this is the phase 1 degeneration, there's a loss of curvature, and so the degeneration is already starting. As you can see, the excess white here, there's this is the phase 2 degeneration, and you can see the arthritis already starting, and these two are trying to fuse. And then on this phase, you can see the bones completely growing together. Now, this totally can be prevented by knowing what's going on with your spine. It's so important. I think that everyone the age of 25 to get one set of x-rays for their spine to basically see what stage of degeneration they're in, and structurally what their neck looks like, or what their spine looks like, so that they can do things about it. And that is strengthening, improving your posture. And one way to really support that curve in your neck is by sleeping on a cervical pillow. So this is one that I've been using for the last 10 years, and I've used several of the different types of pillows. Now, this one is the Pillowpedic. What I like about this is that it has foam in the middle, and that foam actually collapses. And then there's that arch on each side. One is smaller, one is wider. So the best way to sleep is either on your side or on your back, never on your stomach, because sleeping on your stomach causes you to round your shoulders, hyperextend your lower back, and you're not really breathing properly. So sleeping on your side, on your shoulder blade, not your shoulder joint. Sleeping on a cervical pillow helps you from going into fetal position, and it helps you to maintain that curve in your neck, so decreases the stress and damage in the neck. So it's really important to sleep on a cervical pillow, because this is for example, the curve in your neck, and you want something to support it. So if you don't have anything to support the neck, then the arch collapses and your head starts to go forward. And already with phones and technology and things, when we're looking down, we're losing that curvature. So using a cervical pillow, or rolling even a bath towel and putting it under your neck, gives you so much more support than using goose down pillows or any type of pillow that causes your neck to go, or your head to go forward. We're basically forward head posture and hunching over everything that we do throughout the day anyway. So at night when we're sleeping, we want to make sure that we keep our neck in extension, and cervical pillows help to do that. Thanks for joining me. We'll see you on the next one.